Hi, Dr. Henry and Minister Dix. I hope to ask you more about the situation involving Alberta now looking at making people who've tested positive for variants of concern quarantine for up to 24 days. What efforts are being made here in BC to ensure those who are supposed to be quarantining for at least 14 days are actually isolating themselves and others in their home?
So that is, there's a bit of a nuance to that, Marcella. So it is if you are in a close contact with somebody who is positive with one of the variants, because it's more transmissible, and we're seeing transmission in households. So if you are still in that household and people can't effectively isolate within that household, then you are no longer infectious after 10 days. And the quarantine period for your close contacts starts after that infectious period. So that's where you get the 24 days. So they are supporting some people to leave their household for the 10 days of their infectious period and be in hotels or other places. And we have done that in some places as well. Whistler's a classic example where we had a lot of transmission in accommodation, in group accommodations that were related to workplaces. We were able to go in and do some immunization there as well, but it's very challenging to find places for people to safely isolate. And for some families, that's not acceptable to them, so they would prefer to be together at home for that whole period of time. So it's a combination. We've been doing that in many areas of the province. The clusters in the community in Big White and some parts of the downtown east side where we're able to effectively separate people. Right now we do case management and contact tracing and do work with families and have also do asymptomatic testing of people, particularly focused on people with these more transmissible variants. So it is a strategy that is it's more of a localized decision with the local contact tracing team on an individual basis.
Marcella, do you have a follow-up?
I do. I forgot to ask you how many people are isolating now, but if you could add that in. And the other question I had was that you mentioned during your earlier comments about people now having to wait. Could you specify, is that first responders, teachers, like are they essential service workers that may now have to wait a little bit longer to get a specific clinic done for them?
Yeah, so all of I didn't go through all the details today. I'm trying to, do these questions things on Thursdays so that we have a little bit more time to get into some depth. But it will be in the statement. We have about currently active. There's a comma in the wrong spot. I almost had a fit here. It said 75,000. I think it's 7,571. So that is up considerably right now. But in terms of the active cases that are variants, it's down to 192. And there's now about 11,600 people who are self-isolating right now. And yes, our intent was always, the main part of our program was the age-based program with Pfizer and Moderna. And we have this parallel stream that we started with first responders, with workplaces, that was dependent on our fridge-stable vaccine that we were doing in communities with pharmacies and pharmacists assisting at workplaces and work sites.